Okay, this lecture is over the musculoskeletal system. We're going to go over the bones and the muscles. I picked this picture because there's a lot of things going on, both muscles and skeletal bones here with this person. If we start in the chapter here in the introduction, just hovering over some of the bold terms you see right away, we talk about the bones, joints, and muscles, tendons, and ligaments, right? The term there that says orthopedists in that paragraph, we're going to read the next few paragraphs together. Orthopedists are physicians who treat bone, joint, and muscle conditions. Originally, orthopedics was a branch of medicine correcting deformities in kids or children. Ortho means straight, pedo means child. Rheumatologists are physicians who specialize primarily with joint issues like arthritis. Okay, in this context, rheumato means watery flow. It refers to the joint fluid and excess of it. Okay. Physiatrists are medical doctors whose focus is on rehab after illness or injury to the muscles, bones, and nerves. Both an MD and a DO, so a medical doctor and an osteopathic physician, can specialize in orthopedics or rheumatology. MD and DO medical education programs are similar. Both kinds of physicians perform surgery as well as prescribe medicine. An osteopath, though, has added or extra training in the musculoskeletal system, with an emphasis on body mechanics to promote good health. A chiropractor, chiro means hand, is not a physician, but has the extensive and specialized training in using physical means to manipulate the spinal column, the joints, and soft tissues. Chiropractic medicine considers that disease is related to pressure on nerves by spinal misalignment. A physical therapist is a master's or a doctoral degree prepared healthcare professional who develops a treatment plan based on the doctor's diagnosis. The goals of physical therapy or PT are to restore function, improve mobility, and relieve pain. Athletic trainers are healthcare professionals who, working with a physician, provide therapeutic intervention and rehab to injuries and medical conditions. Training includes a bachelor's or master's degree from an accredited school. Passing a certification exam also is required to work as a physical therapist or athletic trainer. So they start here with bones, okay, and go through the formation of bones, the structure of bones. Bones are consistently moving. It's a moving, living thing. In the middle of the next page, underneath the bold term osteoblast, the next paragraph down, it says osteoblasts and osteoclasts work together in all bones throughout life. They tear down and rebuild bony tissue. It allows bone to respond to mechanical stresses placed on it, and it enables it to be a living tissue consistently rebuilding and renewing itself. So there's a lot of change that happens with bones. I think a lot of people don't realize that. We can go through and skip a lot of this anatomy and physiology type part. Not that it's not important, but you will never be in medical terminology tested over the different bones here as well. So do go to the page where it talks about the facial bones. They're all listed in bold underneath here, the facial bones. And I do want to point out, I kind of have a star next to the maxillary bones. Maxillae is the plural there. Okay, so make sure you can get that. If you turn the page, there's the vertebral column and structure of the vertebrae heading. There's two pictures here, a picture of the anterior part of the vertebrae and then the side view there. And underneath I have written, the general structure of a vertebra is A, and that's singular. Vertebra with an A at the end is singular. And then a series of vertebrae, you can see they added an E to the end. That's the plural. Okay, so note that. Turn to the page, bones of the thorax, and then it goes on to bones of the arm and hand. Right at the very top there, you see in bold scapula. Again, there's a plural, scapulae. They just added the E to the end, just like they do to vertebra. Okay. And then at the top of the next page, right above the bones of the pelvis is the phalanges. Okay, phalanges is plural, phalanx is singular. So they're kind of backwards there, but make sure you note that as well. You can go through the yellow vocabulary of the bones, and then we get to blue boxes. And these are specific to bone. Okay, so there's not, I mean, there's more here than there is muscle, but we have combining forms here, calco and calcio, okay, for calcium. And if you don't know which one to use, if you have the little instant translator book, that can help you. You can look up calcium, and it'll say calco use with this, this, and this for suffixes, and calcio use with this, this, and this for suffixes. Remember, we're not creating new terms here. It's either in the medical dictionary or it's not. Okay. Kypho is a good one to remember. Kypho and lordo and scolio are all intermixed here in the next few lines. Kypho is humpback or hunchback. So kyphosis. There used to be a little jingle. Kyphosis, lordosis, and scoliosis. Kyphosis is humpback, like the Hunchback of Notre Dame. Lordosis, okay, and is curve or sway back. And if you look at the pictures below, they can kind of show you. Lordosis is standing very tall. You have that increased anterior curvature there in our low back or our lumbar spine. You think of a king or queen or the lord and lady as standing very tall and putting their nose in the air, and that's kind of what you have to do with lordosis or lordo. And then if you look over at scoliosis, scoliosis is super crooked. Okay, the crooked or bent or lateral curvature of the spine. So know the differences between those. On the next page, we have some suffixes that are listed there that are all really, really good. A couple of them are, I think, repeat, and then we have more combining forms, specific just to the bones. Obviously, the cranio for the cranium, right? Ischio for the ischium. If we were going to write in the definition or the meaning there of ischial, we would say pertaining to the ischium, right? Okay. Same for mandible. Mandibulo for mandible. Mandibular pertaining to the mandible. Okay. Metacarpal for the metacarpals or the hand bones. Metacarpectomy. Ectomy is removal, right, of the metacarpal or metacarpal bones. The watch box at the bottom of the page, peroneo for fibula, that is so odd. There's not much you can do with that, and if you think of something, share it with the rest of us if you would. Peroneo for fibula looks nothing like each other. We're just going to have to remember. But there is a good watch box at the bottom. Make sure you read through that. Then we get into pathology with bones. A Ewing sarcoma, the biggest thing to remember there is that it's something in childhood. Okay, that happens with children. Exostosis. This is such a funny word to say. Make sure you practice this. And exostosis. Okay, exostosis. It says it's a bony growth which is benign. Okay, so safe. Arising from the surface of the bone. A bunion. We've probably heard of that before, right? Maybe we've never heard of an exostosis, but we've heard of a bunion before. A bunion is an example of an exostosis. Fractures are talked about next. Boy, there's a lot of different things to talk about with fractures. A simple fracture, a compound fracture, closed reduction, open reduction, and then the abbreviation ORIF for open reduction with internal fixation. All the different types of simple and compound fractures are listed in pictures on the next page for us. So note that a simple fracture is usually closed, meaning we cannot see it, okay, but there is displacement. A compound fracture means that it has broken through the skin so you can see, okay, that there's injury there. A Colles fracture, you can see that in the wrist, the compression fracture in the vertebra, a comminuted fracture, there's lots of pieces, and then a green stick fracture, it didn't break all the way through, maybe the outer edge broke, but not, all the way through the bone. And you can see there's some good images there on x-ray as well. Osteosarcoma, osteomalacia, osteomyelitis, osteoporosis, all these things that can happen to the bone. Really, really good for you to understand and read through. Preventing osteoporosis, that watch box at the bottom there is going to be really good too. And then as you turn the page, you see, okay, now we kind of start over and we go with joints. Okay, so the different types of joints, the bursae, the pictures above, around here are really, really good. There's some vocabulary joints about or vocabulary words about the joint, excuse me, and then blue boxes here. And not a lot, just these 2 pages, combining forms specific just to joints now. We have ankylo, arthro, articulo, burso, chondro, ligamento, rheumato, synovo, teno, and tendino, and then we have a couple of suffixes, desis and stenosis. So make sure you're making your flashcards and reviewing those for those. On the next page, pathology of joints, arthritis, and all the different types of arthritis are listed there. Those are really good to make sure you know those bold terms that are listed. I really like the pictures actually better on the next page where they talk about a normal joint, then one with osteoarthritis, and then one with rheumatoid arthritis. Okay. Remember rheumatoid has that watery flow. The synovial and the fluids is usually an issue with that. The bunion is talked about at the bottom, and we talked about this a little bit, but I want you to pay attention to those bold terms. Hallux valgus. Another name for bunion is a hallux valgus. And we don't hear that very often, so that's one to pay attention to. On the next page, we have dislocations. Okay, dislocations are talked about. That's just a simple displacement. It can usually be put back into place, or sometimes it goes back into place by itself. A ganglion cyst is talked about and where they usually happen and what we usually have to do for them. The picture is good, and if you read the caption underneath the picture, figure 1525, that's really good. The Bible cyst. Herniation or herniated disc or slip disc is talked about. On the next page, a sprain versus a strain is really, really good. What is a sprain? A trauma to a joint with swelling and injury to ligaments. A strain is overstretching of the muscle. So a strain is less than a sprain. Okay, so you can read that. Then we go through types of muscles, actions. The actions and meanings are really, really good there on page 615 to know those terms, know the difference between abduction and adduction, flexion, extension, rotation, dorsiflexion, plantar flexion, supination, pronation. And then the pictures that coincide with those are on the next page, so those are really good to see, you know, those two. And then we get into more blue boxes for muscles, so we have combining forms for muscles, a couple of suffixes, and then a few more prefixes here. Okay? So not a lot with the rest of the chapter, but once you get to the abbreviations, I would want to make sure that you can always recognize the ORIF, the open reduction with internal fixation. Again, a treatment for fractures.